600-meter underway by Fondor now in the home stretch, heading into the bell lap.
Gordon falling down, gets up quickly, but that's going to cost her. Lucky she wasn't injured.
And Dornan is flying down the backstretch.
She is catching up.
Dornan coming out strong. Dornan all the way.
Never be ashamed of a scar. It simply means you were stronger than whatever tried to hurt you. Have a corneal opacity? Can still smile. Any intrusion or opacity in the pristine refractive medium of cornea causes a significant reduction in vision. According to the slit lamp appearance and the depth of involvement, scars can be classified into nebular, macular and leukomatous. Each of these scars has the capacity to garble vision, especially when near the visual axis. Even in patients with nebular macular opacity, the sophisticated techniques of refractive surgery can help in remodeling and inducing changes in the corneal biomechanics. Erraticism in corneal biomechanics can be used to explain why there is significant variability among patients in how the cornea reacts after laser refractive surgery. Patient's visual acuity must be the endpoint of any procedure, not the clarity of cornea at the cost of vision or the dependence on contact lenses, etc. Corneal topography plays a key part in the decision-making process, Pentacam being a go-to modality in assessment and execution of refractive surgeries. We can take advantage of corneal hysteresis and biomechanics to improve the quality of outcomes after relaxed smile by better controlling the induction of spherical and cylindrical aberrations. According to a study by A.S. Roy et al., small incision lenticule extraction may present less biomechanical risk to the residual bed of susceptible corneas than comparable corrections involving LASIK flaps. Deeper corrections in the stroma may be possible in small incision lenticule extraction without any added risk of ectasia. Small incision lenticule extraction preserves much of the anterior stroma from mechanical disruption. This 27-year-old male presented to a cornea and refractive surgery department with complaints of diminished vision and history of wearing glasses in the right and the left eye since 4 years with no change in the present glass. The anterior segment examination in left eye was normal. However, on right eye examination, a 2 by 3 mm nebulomacular scar near the pupillary margin, which he acquired due to an ocular trauma while playing in childhood. His Snellen's uncorrected visual acuity was 3 by 60 in the right and the left eye respectively. Subjective refraction was -4.5 diopter sphere with -1.5 diopter cylinder at 170 degree axis and -5 diopter sphere with -1.25 diopter cylinder at 180 degree axis in the left eye, which improved the best corrected visual acuity to 6 parts in the right and left eye respectively. Patient was advised relax smile for both eyes. Carl Zeiss Visumax laser system is being used to deliver the femtosecond laser. We are using the expert mode for our treatment. The parameters are set at an interior cap depth of 120 microns and minimal lenticule thickness at edge of 15 microns. The optical zone is 6 mm with 0.10 mm transition zone for astigmatism. The cap diameter is set to 1 mm larger than the lenticule diameter. The total suction time is about 25 seconds. The right eye is operated first, followed by the left eye. Make sure that the excess line is removed from the conjunctival sac. The patient is slowly moved up till the suction cone applanates the cornea. While doing the process, the patient is asked to fixate at the green focus light. Once the central docking and fixation is achieved, the suction is activated. The treatment is centered on the coaxial corneal light reflex and the centration is confirmed using the infrared light. The posterior surface of the lenticule is created first, followed by the side cut, the anterior cap, and finally the incision. The laser is passed successfully. The 4 steps of smile surgery, which are docking, femtosecond laser delivery, lenticule dissection, and lenticule extraction, all went as expected. Even during dissection in the scarred area, we faced no difficulty. Using the spatula, the anterior lenticular plane is dissected, followed by the posterior plane. Once the lenticule is free from all sides, it is extracted using the McPherson forceps. The post-operative uncorrected visual acuity was 6.6 with clear corneal interface in the right and the left eye respectively. The primary cause of diminished vision in most corneal opacity cases is actually not even the opacity itself, but the refractive error that it induces in the cornea. Depending on the type, cause, site, depth of the scars and irregular astigmatism in the patient's eye, visual acuity and quality is affected. To conclude, we can say that even patients with nebular macular opacity with good prognosis can be advised Relax Smile surgery.
Followed up the patient at 1 day, 1 week, 1 month and 3 months post-operative period and noted the autorefractometer findings, manifest refraction, pentacam and point spread function at the respective timelines.